Medicine at your fingertips. Medical apps are bringing the doctor to your living room. There were about 1 million virtual appointments last year. Our Dr. Holly Phillips is with us. Doctor, good to see you.
Good morning.
This is exploding, right? I mean, the first app you're going to talk about, it's members only, though.
That's right. You know, that's an example of a subscription app. It's called Health Tap, and they're best actually known for their question and answer website, where you can ask a pool of thousands of doctors' questions. But now they've added a monthly service where you can do a direct video conference with a doctor.
And how much does it cost to join that type of a service?
I believe their monthly service is around $100 a month. But there's another service that's out there that's very, very popular and generating some controversy. It's called Doctor on Demand, and it's an app that you can use on your phone. There's a fee just for a one-time visit, and you can video conference with a doctor. You can describe your symptoms. That doctor can then diagnose you, prescribe medicines, or just tell you your next step. They might just say call 911 or go to your regular doctor.
We should point out Doctor on Demand is part owned by TV's Dr. Phil and his son, whose shows The Doctors and Dr. Phil are distributed by CBS. Want to make sure we get that in. But how does that work from a medical standpoint? Is the diagnosis effective? Is that really going to work? We're just looking at each other Skyping or FaceTiming, right?
Exactly, Maurice. That's really where the controversy is coming in. You know, these apps are not going anywhere soon. They're definitely popular. They're here to stay. But even though the doctor can see you, or you could upload photos, one of the things that's missing is what we call in medicine the laying on of hands. And that's just a physical exam, a really authentic interaction between people. And that has been shown to be the most effective diagnostic tool we have. Using a video conference, you really don't get that, let alone you don't get blood tests or any other things.
How much are we losing?
You know, it's hard to say. This is all still very new. On one hand, it's hard to get into your doctor on the same day very often. So it's nice to have some resources out there for advice. On the other hand, you don't want to see people relying on this too much.
And talk about that. I mean, that face-to-face experience, you can take all kinds of tests that you can't do on FaceTime that are incredibly important, like blood pressure.
Absolutely, absolutely. And there's also just something about seeing a person where you can really start to feel how sick they are or not. There's actually another thing out, only in New York City right now, which is a house call service. It's called pager.com. It works a little bit like Uber. You can dial up a doctor, have them come to your house, then you do have a physical exam, whether it's for an acute illness or you can even book a physical that way.
Kind of like the way that sounds. Now, who should be using this kind of thing? Who's it for?
Right. You know, it's still better to see your doctor in their office. But if you are going to use it, it's safest for young people who are healthy and don't have multiple complications, right? This should be used for pink eye or a sore throat, never for diabetes or something with long-term concerns.
I mean, this is sort of a concierge type of medicine and probably not covered by insurance, right?
You know, a few of these apps are going to be offset by some insurances, and some employers are even providing the service as part of their coverage because they think that it gives people greater access to doctors and keeps them healthy and at work. So I do think this is something we're going to continue to see in the future. I just hope it doesn't overtake the real doctor visit.
But you think about the things you might miss, right? Those surprise diagnoses, the lump or some sort of strange disease, right?
Maurice, that's just it. Sometimes things that look very simple actually aren't. But that's one thing. If you do use one of these apps, make sure you get a record of your visit and you go back and follow up with your real doctor just to make sure nothing was missed.